much for tuning into the Wellness Exchange. Today we are talking about eating disorders with Miss Norma Beardwood, who is a clinical professor at UTRGV and a registered dietitian. We hope you enjoyed today's video and please subscribe. Thank you so much for being us with here today, Miss Beardwood.
Well, thank you for inviting me.
Absolutely. Thank you so much. So we'll go ahead and get started. So what would you say, or why is it important, to talk about eating disorders?
Well, this is what I've lived in the Valley since 1985. I'm originally from Rhode Island. And when I moved down here, it was very clear to me that a lot of the eating issues that you would identify under eating disorders basically get overlooked when you go to the doctor's office. It isn't something that is necessarily screened for. The other thing is that in some cultures, thinness is expected. In other cultures, if you go visit your grandma and you've just eaten, she may have a spread for you to choose from. The expectation is that you are going to eat, and it would be considered an insult if you did not. Mm-hmm. I don't believe down here in the medical community that we're doing enough screening. And there are examples of the prevalence that we can talk about eating disorders. I actually went and did some research to find out the prevalence of eating disorders among Hispanics.
Oh, wow.
To be able to determine how it compares to the rest of the population. So what I'd like to do is kind of outline for you the different major types, primary types of eating disorders that need to be addressed. So first of all, I want you to see some of the famous people. You may not know all of them, but depending on how old you are. But Tracy Goldman. No, I'm sorry, Tracy Gold. That should be from Growing Pains. I have an error in my slide. Terry Schiavo, that was several years ago where the husband was trying to disconnect her tube feeding because she was not going to be able to ever be a viable person. It was a lot of controversy over that. And then, of course, during the marriage of Princess Diana to Prince Charles, there were issues with Princess Diana having an eating disorder. And then there's some others that you can maybe recognize. So some of the issues that we're looking at, this all comes from the Diagnostic Statistical Manual, number 5. And the first one is Anorexia Nervosa. Basically, this is a condition where there's a restriction of energy. So the client is not eating a lot of food. It will result in a low body mass index between 15 to 17. Normal body index is 20 to 25. There is a big intense fear of weight gain, and there is a disturbance to the body shape, constantly self-criticizing how you look, looking at yourself in a mirror. They typically will do some kind of restriction or some method to get rid of the calories they may have eaten. This could be dieting, fasting, or over-exercising. And then there are some clients with anorexia nervosa that will also purge, where they will on purpose cause themselves to vomit. They may be misusing laxatives, diuretics, or enemas.
Oh.
The second primary one is bulimia nervosa. And this is when there are many episodes of binge eating. The criteria you have to meet is at least once a week you are having a binge episode, and it goes on for a period of 3 months. You typically would eat a large amount of calories in a very short window of time, maybe 2 hours. So possibly this person would go buy a dozen donuts and a store-bought cake and consume all of those in a 2-hour time frame. they end up feeling like they have no control over eating, and they have inappropriate behavior where they will try to get rid of some of the calories. And this may occur 1 to 14 or more times a week. So that behavior would include the purging of some method. And they are very critical of their size. So this client, again, they'll look in the mirror, but they also may look in their reflection in a window, in a picture frame as they're walking by to see how fat they appear. The next major one is binge eating. This is recurrent overeating, episodes of binge eating. It is a lack of control over eating. The one thing that makes this different from bulimia is there is no purging. So you have to have 3 or more of the following conditions to be identified as a binge eater. First of all, eating very rapidly. This does not allow your stomach and the vagus nerve to communicate to your brain that you actually are full. So you are able to consume more than what would be expected. Eating until you are uncomfortable. Eating larger amounts of food when you're not hungry. Eating alone, eating in your car, eating in your room because you might be embarrassed by the amount you are eating. And then feeling disgusted about yourself, your body. They will have a lot of guilt, shame over the behaviors that they are engaging with food. And this happens at least once per week for 3 months.
Mm-hmm. So there are specific guidelines for every one of these major eating disorders. So let's say like somebody might say, oh my gosh, I feel like, I ate so much at lunch or something. You're not necessarily have an eating disorder, but if it's something that's happening, quite often, like you're saying with these guidelines, then that could be something to look out for.
Absolutely. I think all of us probably have a binge eating disorder on Thanksgiving Day.
Right.
That doesn't necessarily mean that we have it is a chronic condition. Mm-hmm. Okay. Some of the other categories of eating disorders include other specified feeding and eating disorders. This is basically when it doesn't meet criteria for one of the above 3 that I've just talked about, but there is a specific condition that is creating this. Then there's unspecified feeding or eating disorders, which also includes not meeting criteria, but there is no specific condition either. Okay, next is avoidant restrictive food intake disorder. And this basically is happening when there's a persistent failure to meet appropriate nutrition energy needs. So there's going to be significant weight loss. There may be a nutritional deficiency. One of the micronutrients may be obvious that they haven't been consuming. They may be dependent on some kind of tube feeding or oral supplementation. And they have issues with functioning out in the community, psychosocial issues. So they don't fit in. They may decide not to go on a social event because they can only eat certain food, and so they have to stay home for that particular food. The next one is, I've heard it pronounced 2 different ways, so I'm going to give you both, pica and pica. Mm-hmm. Most of the time we see this in women who are pregnant. Mm-hmm. They have a craving for non-food sources, so they may be eating dirt, clay, ice. This, to be identified as this type of problem, they need to be doing it for over a month. Usually, you'll see this, if it's not due to pregnancy, It's due to an intellectual developmental disorder, autism spectrum, or schizophrenia. And then rumination disorder. This is the best way I can explain it is like what a cow does. You know, a cow chews its food and then regurgitates and chews again. This is kind of like that. And so people will repeatedly spit out or vomit, regurgitate the food over a period of time for at least 1 month. Often the regurgitated food may be rechewed, so eaten again, swallowed, or spit out. You're likely again to see this in intellectually developmental disorders. And then there is body dysmorphic disorder. I want you to take a close look at some of these. Now, think about the last time you saw Joan Rivers. She's a comedian. She's a beautiful woman in this picture, but she did not look like this by the time she died. Michael Jackson is another person who went through a lot of plastic surgery didn't even look like he was from his actual race by the time he was done. And then the woman below, she's called the Catwoman. And her name is Jocelyn Weidelstein. And you can see her before picture. She almost kind of looks like a Barbie doll. But by the time the plastic surgeon got through with all the work that she wanted done, because she did want to look like a cat lady, this is the outcome of her appearance. So it's pretty drastic. Now, like I said before, I went and looked to see about prevalence for Hispanics with eating disorders since we live in the Rio Grande Valley. And I have 2 references. One was from 2007, and the other is a more recent reference. So I want to actually read this verbatim, if at all possible. Latinos have elevated rates of any binge eating and binge eating disorder, but low prevalence of anorexia nervosa and bulimia nervosa. The US born and those living a greater percentage of their lifetime in the US evidenced higher risk of certain eating disorders, while severe obesity and low levels of education were significant correlates. Rates of treatment utilization were exceedingly low. So within the population, you're more likely to have binge eating, but it goes unidentified or goes untreated in that particular population.
We definitely know that eating disorders is you could say a taboo topic to discuss, I feel, within our culture. It's not necessarily talked about much, which is why I definitely wanted to bring some light to the issue in this Wellness Exchange interview. So that the data that you just read off definitely correlates with the culture, I feel like.
So that was an older reference, but the more recent reference says lifetime prevalent rates of anorexia nervosa are lower among Hispanic Latinos than non-Hispanic whites. They are comparable rates of bulimia nervosa and binge eating. So now binge eating and bulimia have been added to the mix within the Hispanic population. Binge eating disorder is the most common eating disorder among Hispanics, Latinos. So as they become more acculturated, depending on how far removed they are from their country of origin, it does seem that they do have a possibility of developing some of these issues or concerns.
Okay. So generally speaking, what is there, or is there a specific age group that you would say that where eating disorders are more common?
Yes. The specific age group, it can start as young as 6. I have seen 6-year-olds, but it typically starts about the age of 18 to 20, according to the statistics.
Mhm.
My personal observation has been it will start more around, for females at least, around the age of puberty.
Mhm.
Oftentimes they will have experienced some kind of trauma in their life. And so in order to handle that trauma better, they try to control their body. And I'm trying to be kind of somewhat transparent without going too far into detail. But for example, one of the things that you'll see is somebody has been sexually abused. That's very traumatizing. And so once their body starts to develop female shape, they become more attracted to males. They don't want that because they were traumatized. And so in order to prevent that from happening, they will go ahead and purposely bind their chest to make it look as flat as possible, or they will develop some other types of eating issues that will prevent them from, getting an hourglass figure.
Mhm. So it becomes more of a control, having
Yes.
control over your own person.
Absolutely. Anorexia nervosa is actually prevalent in about 0.6% of the adults in the United States.
Mm.
It is 3 times higher in females. In reality, the older book that was used to diagnose eating disorders actually had that you had to have stopped your menses. That really then did not allow males to be diagnosed with anorexia nervosa. Now, with the addition of the 5th edition, they have made changes, so that is no longer a part of the criteria that you have to meet.
Okay.
The next one is bulimia nervosa, and the overall prevalence is 0.3% in adults, and it is 5 times higher in females. So we have the gamut on this particular disorders.
Mhm.
And then binge eating disorder is 1.2% prevalence in adults, and it's 2 times higher in females.
We can go ahead and look at some of the causes of an eating disorder. Are there specific triggers, you could say, or moments of kind of that flip of the switch for specific eating disorders?
Absolutely. Basically, the literature says that it is still unknown.
Mhm.
Like, how could that possibly be? We've been dealing with eating disorders since the 1700s. So one of the things they are aware is that there seems to be a genetic proclivity for having eating disorders. And the brain, when they do an MRI of the brain, it actually triggers the brain activity differently than somebody who doesn't have an eating disorder. So we do know that there's something going on. There's a misalignment, a misfire in the brain.
Okay.
There also can be comorbidities. And what I mean by that is if somebody has major depressive disorder, one of the possible symptoms could be a change in eating.
Mm.
It could be overeating, it could be undereating. Well, as a clinician, when you're looking at this, you need to be able to determine, is this just a temporary change because of the depression, Or do we have an eating disorder issue plus depression?
Mhm.
And so being able to determine what that is. I've already mentioned that there are issues with abuse.
Mhm.
Often with people who have eating disorders, they've even been susceptible to trauma
Mhm.
at some level or sexual abuse.
Mhm.
And so the whole process then becomes trying to have some kind of control over something, since they had their control taken away over their personal body. Another area that could be responsible or contribute to the causes of an eating disorder would be the environment.
Mhm.
When your child goes to school or lives in a home where parents are very critical, they pick up on things, and so they try to be the perfect child. They go to school and they want to be the perfect student at school. They may hear commentary from their friends about their size. Maybe they're the biggest of the group of friends that they have. Those kind of comments will stay with the child.
Mhm.
It's never a good idea to be commenting on size. You can comment on, hey, why don't we go and take a walk this afternoon? I think that sounds like fun,
Mhm.
but not on anything that has to do with size.
Right. Right.
I've talked about the gene pool. Okay, a lot of times, another thing that will happen in the environment is mom will always be dieting.
Mhm.
Got to keep my figure, got to restrict food, can't have that Snickers bar. Some individuals will actually get a high off of the restricting, kind of like a runner. When they get to mile 18, 19, they talk about that high that keeps them going to get to the 23rd mile. There's also guilt and shame involved. So you have a client who has just eaten that dozen donuts and a full cake. Then they beat themselves up emotionally the rest of the time. And then during COVID, I saw an article where they were looking at how clients with eating disorders in the UK were dealing with how to handle buying groceries and that type of thing, because they don't want to get sick, but yet they need to be eating, but they don't want to eat. So that's a great excuse not to go to the grocery store. My PCP that is down here in the area, she told me that people that are young, 20, 30-year-olds, when they have come into her office during the past 2 years, they have gained about 40 pounds on average. Because they're at home, they're bored.
Right. Yeah, I know COVID has definitely been a huge barrier. I know for a lot of people that has thrown them off completely from their from their normal routines, and especially being away from your social circles as well can cause those major personality and characteristic shifts from what we were used to. So definitely that I mean, even I know my family, we've all had that toll taken on us from COVID. So,
well, to be transparent, I went in and I had gained 4 pounds after 2 years, and I was beating myself up. And when I mentioned it to her, and she kind of chuckled and said, "Oh no, you're good." And that's when she told me, and I was like, "Wow, okay, I'll take this as a plus for me."
right.
Okay, so I wanted to talk about some other causes using pictures. This is not the best picture as far as clarity, but we all, even now, Mattel has great impact on selling Barbies to young girls. When you look at Barbie, it looks pretty innocuous because we've had it in our culture for so long. But if you compare Barbie to a life size of a person, this is what Barbie would look like on the left-hand side versus the Barbie on the right-hand side, which is more apropos for what we actually look like.
Mhm.
So there is a big difference.
Right.
You know, that gap, some girls really work at trying to get that gap between the thighs. That is not even realistic as to what we're looking at. We also are influenced by fashion in magazines. And we see these models that are size 0 going down the runway, demonstrating some new fashion style from a designer. But as you can see, this part here, that is not healthy. That is not normal. Some other things that are some other populations that are at risk. And I think you can see here, this is Kathy Rigby. She was a gymnast in the Olympics. This is Christy Hendricks. She was also a gymnast at the Olympics. And this is just a picture of some jockeys. But the professionals that are most vulnerable, dancers, ballet dancers, models, actresses, wrestlers, they have to get a weigh-in and they have to be at a certain level.
Right.
So at the last minute, they're either purging or trying to dehydrate themselves in order to meet weight. Notice the last one. I put that there on purpose. We do have dietitians. Dietitians want to heal themselves, right? And so you go into a profession that you want to learn more information about. So there are dietitians out there who do have or had eating disorders. I want to focus a little bit on Christy here. You can definitely see the change in appearance. For her height, which is very tiny, she should weigh at least 95 pounds. So she is 40 pounds underweight in this picture.
So how would you say, we've discussed, so many really important topics, but at some point, eating disorders can become dangerous. And so how dangerous can eating disorders become?
Great question. Every 52 minutes, someone dies due to an eating disorder.
Wow.
That's phenomenal. 28.8 million Americans are struggling with eating disorders. Of that amount, 26% attempt suicide, and at least 6% are medically underweight. So that means their BMI is going to be at that 15 to 17%. Okay.
So my next question would be, when we do kind of start to see those patterns of symptoms or signs or anything, when is it appropriate to kind of say that somebody might be wanting to seek help? And so would they go see a registered dietitian or their primary care physician? Who kind of is involved in the treatment of eating disorders?
It really needs to be a whole team approach. You do need to go to your primary care physician or practitioner. They need to be aware that this is an issue for you. You need to be assessed physically. Do you have an electrolyte imbalance? Are you dehydrated? Is constipation a problem? What's going on? Have you lost bone mass? You also need to then have that doctor refer you to a psychiatrist. The psychiatrist is going to be the person that's going to give you medication that will stop or decrease the thinking process in regards to food. One of the things that can happen with the bulimia is that you are throwing up.
Mm-hmm.
That's not a normal state for your mouth to be having. Your stomach content is very acidic. So when you are throwing up, you are exposing all of your teeth to an increase in wearing down the enamel on the teeth. So it is very important that you do see a dentist, therapist, so that you actually have that once a week 50-minute session to talk about your relationship with food. Registered dietitians, according to the Academy of Nutrition and Dietetics, should definitely be an integral part of this team. Mm-hmm. They're going to be working with the client as far as the relationship with the food. They may also need a registered nurse or a licensed master social worker that can help them get resources that they need in order to combat or control the eating disorder. Mm-hmm. You do need to get the client to agree that you can communicate amongst all of these people because of HIPAA, so that everybody on the team is on the same page.
So, sorry.
If I can go ahead, I added this last night, actually. Mm-hmm. I wanted people to be aware of questions that could be asked. This could be asked in the doctor's office. Mm-hmm. It's 5 questions, very straightforward. If you answer yes to 2 or more, it is suggesting that you could have some type of eating disorder.
Very important. Important to analyze, I think, ourselves and kind of take that time to ask ourselves those questions, even if I feel like we may not think that we have, an eating disorder. It might be best to kind of analyze ourselves, take a minute to answer those questions and look into, our own person. So, very important question.
Mm-hmm. This is something that needs to be taken seriously, just based on the mortality rate that I've already shared with you.
Absolutely. So what would you say are some resources that are available for someone suffering from an eating disorder? Are there, a lot of resources available for persons with an eating disorder, or maybe not as many as we would like to see?
Down here in the Rio Grande Valley, there is not a lot of structured resources for eating disorders, unfortunately. Mm-hmm. So if this has been identified, what my suggestion would be, get the client to be admitted for stabilization if they meet the criteria to an acute care psychiatric facility or an acute care hospital. The reason why I say acute care hospital, they may be so ill that they can't be treated in an acute psychiatric facility. They may need to be put on, they may need a tube feeding, they may need hydration, they may need et cetera, et cetera. So they need to go there first. Mm-hmm. Once they're there, then you can start to look, maybe the social worker, the case manager of the hospital can go ahead and start looking for an eating disorder treatment center. I did look to see what was available in Texas, and we do have several specialized hospitals. And just to give you a list of them would be Eating Recovery Center. This is available in Houston, Austin, Dallas, and San Antonio. Clementine, the Woodlands, Eating Disorder Solutions, which is in Dallas, and Center for Discovery in Cypress, Dallas, or Austin. Now, these are in Texas. They are not, from my standpoint, the most well-known for treating these conditions. So if you were to go out of Texas, the ones that are the closest to where we live would be Timberline Knolls in Illinois, Renfrew Center in Nashville, Acute, it's an acronym, Acute in Colorado, or Monte Nido and its affiliates in Arizona.
Wow.
So these places, that's specifically what they're dealing with.
Mm-hmm.
And they have the whole team already set up. It's also important after you've been in a treatment facility that you have some discharge planning. You can't just go home and expect to function normal.
Mm-hmm.
You're going to need support. So I can tell you that there is one outpatient setting, a therapist that does eating disorder issues, but she's not accepting any new clients right now. Another option is to go online, and I'm not trying to toot my own horn, but I do have, I do work for betterhelp.com. I don't know how many other people on that platform actually have eating disorder background.
Mm-hmm.
But that's another way you could possibly look for help for outpatient services. And that would be a virtual outpatient therapy.
Okay.
Dietitian-wise, I believe I'm probably the only dietitian in the area
Mm-hmm.
that actually deals with eating disorders. But unfortunately, I have 2 jobs.
Mm-hmm.
And so I don't have a lot of time to devote to this. So my suggestion would be to go this route that I have shared with you.
Okay.
You know, talk to your doctor, let them know what's really going on with you, be admitted for stabilization if needed, get into an eating disorder treatment center,
Mm-hmm.
if at all possible, and then follow up with outpatient.
Definitely. Well, I think really I just wanted to ask you one last question, which is, is there anything else that you would want to share with our audience of employees regarding eating disorders?
I guess the last thing I'd want to share is that I appreciate the opportunity to be able to talk about this because February 21 through February 27 is National Eating Disorder Awareness Week. So that's just around the corner.
Mm-hmm.
It's important for everybody to at least be aware that this does exist out there, particularly down here. It's going to be more binge eating and bulimia nervosa because of the population that we live in.
Mm-hmm.
But it is something that is treatable. So please, please, please use the screen information that I gave you for SCOFF and try to get some help in some manner so that you are having a good relationship with food.
Awesome. Thank you so much. Thank you for being here with us today. We really appreciate your time, your information, this really great presentation that you put together to really emphasize which aspects of eating disorders, are such important topics to discuss. And so I think our employees will really be able to benefit from this information. So thank you again, Ms. Beardwood, for being with us here today.
Absolutely. And again, thank you for the invitation.
Of course. Thank you so much. Thank you so much to our viewers for watching. If you haven't already, please subscribe to our YouTube channel, and we'll see you next time on the Wellness Exchange.